Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. If you are new here or if you're a regular viewer that has not yet subscribed, as always, I ask you to please go ahead and subscribe because this way you help a lot of other people find this content and you also help me as well. Also, don't forget that linked below is a completely free quiz, Am I Transgender? In case if you are in complete confusion land, down below is a complete free copy of my entire book on new terms, gender transition redefined for adults. It is really quick read. It is to the point, punchy, it's great. Everybody who has read it has told me how much they loved it, and that's one of the main reasons I decided to offer it completely for free because I've been getting such fantastic reviews about it. I thought this needs to be accessible to everybody. So grab your copy below, completely free. For today's video, I will be sharing with you 3 things that, as a gender specialist, as somebody who is deeply knowledgeable when it comes to gender dysphoria, 3 things that I wish everybody knew before they even considered or before they started hormone treatment. And this is going to be for any types of hormones, whether you are considering feminizing, masculinizing, a combination, any kind of hormonal regimen. Now, before I get into the top 3 that I think everybody should absolutely know before getting into hormones, I want to make it very clear. Seldom when I make content like this, somebody chimes in saying it sounds gatekeeping. And I want to be very clear, and I think a lot of you already know this. My content is absolutely nor gatekeeping content, nor is it a cheerleading content. I'm not here to create fear-mongering for you in order to avoid a happier life, nor am I here waving a flag in order to tell you that transition is the only way, and if you transition, all your problems are going to go away and you're going to be fully happy. My goal here is to make impact with objective information, to hand it over to you, and then for you to be able to utilize it best fits your life. And if people think, or if anybody watching this thinks this video particularly sounds like gatekeeping, then I would then have to say that unfortunately you are not familiar with my content and the impact I'm making with the content thus far, because my information is actually quite objective. So having said that, I am going to share with you now these 3 absolute essentials. I've seen these 3 things cause so much distress. I've seen people completely stop their gender transitions and not even moving forward because of one of these factors. I've seen people regress back. I've seen so many things happen. I've seen so much pain and suffering because one of those 3 things came up. So let's say you want to start hormones, or maybe you're already on hormones and you want to see if you have considered one of those 3. The first thing that I absolutely recommend before you want to start hormones is to be clear on what is your outcome. I always talk about knowing your goals ad nauseum on this channel. And one of the most important things is just to have an idea specifically from hormones, which is aspect of a medical transition. What is it that you want to get? What is the outcome? What is your end goal from the hormones? Is your end goal that you're going on feminizing hormones and you're hoping that the hormone is going to feminize you to the point where you're not going to need any surgical interventions? Is the end goal that you're hoping that hormones is going to solve all of your problems? Is the end goal that you think that masculinizing hormone is also going to masculinize you? If passing matters to you, then you're going to pass with flying colors. What is your expectation in other terms? What are you expecting to get out of the hormones? To be very, very clear about your expectations. And then when you're very clear about your expectations, the reason why it's so important to be clear on what your expectations are is this. I've seen so many people create a dependency based on and of their expectations. I have seen so many people whose expectation was, I'm going to go on testosterone and I'm going to have my voice deepen and I'm going to get facial hair. And without a doubt, people will never misgender me. And while testosterone is a powerful, strong hormone and does produce that results by far and large, it doesn't happen like this for everybody, right? I've known so many trans masculine individuals who were on testosterone for 2, 3, 4 years, and their voice were still not fully cracked. I've known individuals who still have not gotten their facial hair, and when it started coming in, it would come in patches. So having this expectation that either one of the hormone or combination or variation of some kind of regimen is going to suddenly give this results, and then based off of those results, you have these expectations, is one of the it's almost like you're creating a mirage for yourself. You have to be rooted in realistic expectations, what you can expect from hormones. And the reality is that this is absolute reality for every single one of you. The reality is that you will not know what you're going to or can expect from hormones unless you do it. This is truth. Hormones do and create changes that are variable across individuals for numerous reasons. I also talk about it ad nauseum. One of the reasons is how your body metabolizes hormone. Another reason is your age. So there's so many factors that go into it. So you won't know until you start. And if you are not following and allowing the organic changes to come in, and if you are not suspending at least some of your expectations, then you're putting yourself in a position where you are going to be crushed. And I have seen so many of you crushed because so many of you have expected that I'm going to start my social transition, and alongside of my social transition, I also started medical transition. And this is so great because 6 months from today, I'll be able to fully present feminine and none of the misgendering is going to happen, or fully present masculine, or fully present as whatever you identify, and none of the negative things are going to happen. And why are the things still happening? Why am I still struggling? Why is my voice still the way it is? All of the things are crushing, and they're crushing because you were expecting too much without rooting those expectations in how it's actually situated within your reality, within how you metabolize it, how your body responds to it. So this is the first thing. You don't want to become dependent on expectations. Trust me, I've seen too many people. I've seen people who have given up on their transition because they said, this is it. I do not want to have any surgeries. Maybe I can't even afford any surgeries. Maybe it's not even accessible to me to have any surgeries. And so it's really hoping that hormone alone is going to do all of this. And now that it doesn't do what I wanted to do, there's no point for me to transition. And that heartbreaking. It's heartbreaking because even though we live in a society where we put so much emphasis on physical and body, when I work with clients, the goal of any element of gender transition is, sure, physical part of it, but the bigger part is for you to feel less pain and suffering and angst and tension that comes from living with gender dysphoria. By the way, if I had one agenda on this channel, my agenda on this channel would be to ease pain and suffering that comes from gender dysphoria. Whatever means you choose to ease that pain, and sometimes just accepting that you're transgender or having gender dysphoria can help with that. But it's to ease the suffering and pain. And so when you're putting all the eggs in one basket and hoping that one basket is going to be this physical, how you're physically going to unfold, depending only on one element of, and in this case, of hormones, and it doesn't work out, it's devastating. It is devastating. So am I saying you should not have any expectations? Absolutely not. Am I saying that you should not step forward not knowing what they are? Absolutely not. It is way better. Trust me, you will cope with things that come up way better. You'll be more adaptable, more resilient if you step forward in the medical transition, knowing that here's what hormones can do in extreme cases. Here's what I know that it might take actually a long, long time. Am I okay that things might happen really fast? Am I okay if things are also going to take very slow? And then between realizing and reconciling being okay with things maybe happening very fast for you, then congratulations, but maybe things happening very slow for you. But once you prime yourself and you're ready for it, you move through things better because you have adjusted your expectations accordingly. And then you can also observe what actually happens in regards to you. What's your relationship with the hormone you're taking? How does your body changes on it? And you have a much more smoother transition, trust me. So knowing what do you expect out of hormones, and then being realistic about it and not becoming very dependent on that outcome. So the last thing you want to do, trust me, just believe me when I say this, the last thing you want to do is you want to have if-then type of things. For example, if hormones are going to make me look like an absolutely stunning woman, only then will I fully come out to the rest of the world. If hormones are going to give me facial hair, only then. You don't want to have if-then games with yourself because we're talking about gender dysphoria, right? We're talking about something that pains and induces a lot of discomfort inside of you. If-then doesn't fit into this, I'm sorry. And so you want to be careful with that. So this is my number one. Be clear about what your expectations are. Don't become dependent on those expectations. Know that you won't know until you step into it. The second one that I wish everybody knew before they even started hormones is had not only, and I assume everybody has medical appointment, not getting their hormones off the black market or whatnot, or, I've heard people who take birth control pills from their partners. I really think it's important not only to have a medical appointment with a medical doctor, but apart from having a medical appointment, not to depend and expect that that doctor is going to be very knowledgeable and do your own research. Now, when I say do your own research, I don't say Google search and then go and listen Reddit or listen to. I'm not saying that all those things are not credible. I'm just saying that you're falling into the trap of listening how things affected other people. What you want to look for is scholarly articles. What you want to look at is scientific research. What do we know up to date about the hormones you want to take? This idea that feminizing, masculinizing hormones are 1000% safe is not true. Again, I'm not about to throw fear-mongering at you. You're all adults. And I think as adults, I think a lot of you realize that. They're not 1000% safe. When I say not safe, I don't mean that they're also unsafe. Any medicine, any medical treatment is going to help and may potentially have side effects. Advil helps. Too much Advil has side effect. I had chemotherapy when I had cancer. But let me tell you, it's one pure poison. It helps kill cancer cells. It also kills other parts of your body. It affects other organs. So there's always going to be a trade-off when it comes to medicine. And sometimes we're very lucky not to experience the side effects. And that depends on how healthy we are and on numerous other factors. When you go to doctor, medical doctor, not only is it important to talk about your expectations and to have your physical health assessed for hormones, but it's also important to ask your doctor, because not every doctor is going to tell you this. What up to date do you know? What is the research about pros and cons? What are the side effects of long-term taking testosterone? What are the side effects long-term taking estrogen? If doctor doesn't know, do your research. Even if doctors knows, do your additional research. I'm saying this because the more you are aware, the better off you're going to be, because if, God forbid, if any of the side effects happen to you, well, then you're not shocked. You're not disempowered, you're not feeling like you've been taken advantage of. You realize that, yeah, I was aware that this is a possibility, but the trade-off of not living with gender dysphoria is greater. And this is why people step in the medical transition, because the trade-off is so much greater. Let me give you an example. Right now, we know that research-wise, feminizing hormones have lesser long-term side effects than masculinizing hormones. Masculinizing hormones, for example, we have a lot of research now. We have a lot of self-reporting from trans masculine community that, for example, individuals are experiencing vaginal entropy, for example, that can cause a lot of pain and discomfort. That's something that's important for people to know, not only for their long-term health, life, but also for their sexual lifestyle, uh, sexual satisfaction. And if people know this, well, then you have an opportunity to then ask medical doctor, well, if that even happens to me, what are my options at that point? What are my options at that point? And that's why it's so important. Again, this is not about fear-mongering. Clearly, there's people who have been going through medical transition throughout their entire life, right? Because for a lot of people, they depend on those hormones. You don't just take hormones and stop. A lot of people don't, unless you want to achieve particular changes. But for a lot of people, you need that hormone in your body, because sometimes people have gender-affirming surgeries that eliminate other ways of body producing natal hormones. And so we know that people live healthy, long lives, right? And then there's also people who have side effects. And like I said, like with any medicine, there's pros and cons. But again, I don't want to hear I want to be very clear that without a doubt, medical transition the side effects for a lot of people outweigh the pain of gender dysphoria. That's a fact too, for sure. But to think that you're stepping into medical transition and that these hormones are absolutely safe, it's not that they're unsafe, but let me rephrase it. To say that that the hormones that you're stepping into are without any potential side effects is also not true. So have the discussion, do research. Why? Again, you're better off prepared. So then when it happens, you're not devastated. So then you can say, oh, that's right. I read about this. Right? So I'm recording this right now. I can hear ringing in my ears because I have tinnitus, which is side effect of long exposure to chemotherapy, including hearing loss, which I also sustained. And I was fortunate because my surgical and medical and oncological team did a great job explaining that to me back then when I was 16 years old. And I'm very good at advocating for myself and not daily, but still to this day, talking to medical doctors, asking what other side effects I might experience as I get older. What are the other side effects from such exposure? I had 16 chemotherapies. Now, do I regret getting chemo? Absolutely not. It saved my freaking life. I would not be here. But yeah, I also have to acknowledge that this is what I might potentially happen to me, and the best I can do is be healthy. That's another thing. Once you know there's potential side effects, it also gives you opportunity to take accountability and responsibility and maintain a healthy lifestyle so that you can minimize all of those things. So that's the third thing that I wish everybody would do. Not only talk to their doctor, but also look at the medical research up to this point, just so you're better equipped. Again, does it mean you should not step into medical transition? Of course not. It means be better informed. And the third thing that I highly recommend for anybody who are thinking about starting, or maybe you already are on hormones, is this. Have plan B. That's right. Have plan B. What do I mean by having plan B? What I mean is this. Whatever where your expectations and goals are in the first scenario that I said, and whatever you learn and realize about potential side effects, when you take all of this, If some of this were to happen, what would be your plan B? For example, some people have a very big expectation that when they're going to start hormones, they are expecting particular changes by particular set time period, and then they have an outline that that's when they're going to come out at work, and then they have a timeline that that's when they're going to do another thing, and that's when they're going to do another thing. But things don't work out like that. So be open to things not working out, and beforehand, ask yourself, what would be my plan B? What would that look like? You may have selected your favorite surgeon for, let's say, FFS, and you were hoping that they were going to see you right away, and then you go see them and they tell you, I can see you right away, but I want you to be at least 1 year on hormones. This is how I operate. Now you're thrown for the loop. So always have plan B for everything, or at least be open to the possibility of plan B. I see a lot of people putting so much, again, dependency on the hormones that they're not asking themselves, but what if this doesn't happen the way I plan out for this to happen? What if things are going to take longer? What can I put in place to help me adjust if things take longer? If things are going to take longer to feminize or masculinize my features so that I can avoid being misgendered, what can I put in place that can help me cope if that were to happen? Can I start working on finding and creating bridges within support network, support systems, so that when that, if that happens, I have the support that I need? Having plan B is going to be essential. It is going to be important. What if I start on hormones and I realize I have a reaction to hormone? What if I realize that for health reasons or otherwise, I can't take hormones? What is my plan B? Does it mean I just stop owning who I am and evolving into I am? What are the other options there for me? The more you expose yourself to different possibilities beyond just medical hormones, the better off you're going to be. And the more you're also going to realize that gender transition is a holistic approach. It has to be a holistic approach. It's not just about the physical. Physical is important, right? It's huge. It is significant. But it's not just about physical. It's also about psychological. It's also about so many other factors. And so it's really important to have a well-rounded, this is you living your life. This is you navigating your life. It can't just be so dependent on this one factor of hormones and hormones alone. So that would be my recommendation. These are my 3 most important things that I wish everybody knew when they started. Or if you're going through this, it's not too late to stop until you reevaluate, because it's important. Those things are important. They play a role. And the better prepared you are, the less devastated you're going to be. The more grounded and uprooted you are in objective things and objective reality around your circumstances, the better equipped you're going to be to handle if anything ever happens. And I hope nothing happens, but if anything happens, you're so much better equipped to deal with it. Trust me. So comment below, let me know if you experience any of this, and I will see you all next time. Goodbye.